Welcome to OncoPharm. I'm your host, John Bazar. I'm a professor of pharmacy practice at ETSU's Bill and Gatton College of Pharmacy, and this podcast is sponsored by Kelly C. PharmD, an oncology education company for pharmacists. This episode will be a little abbreviated, a little shorter maybe than usual, but out early because of HOPA, because of the Hematology Oncology Pharmacy Association annual meeting starting on Wednesday, the 25th. So the main update to talk about today is the FDA approval of Nivolumab in combination with AVD, doxorubicin, vinblastine, and dacarbazine for stage 3 and stage 4 classical Hodgkin's lymphoma. This is a study that we have talked about in the past. This is Herrera et al. Published in NEJM in October of 2024. About a year or two before that publication at NEJM, we had the early readout of this an ASH abstract looking at the safety of this regimen compared to BV-AVD in elderly patients, where it's much safer, much less hematologic toxicity, and less neuropathy, of course, without the brentuximab vedotin. And so this has been a really attractive option, and this has moved to the front of therapy because of the great outcomes. As well as the safety here. So we're seeing better PFS benefit, similar overall survival, and less toxicity. What is a little bit curious about this FDA approval, not that it happened, and it's for ages 12 and up, so it includes some pediatric patients, which is great. But what's curious about the approval is that like the FDA readout or the FDA press release, as well as the PI say primary granulocyte colony-stimulating factor is recommended with Nivo-AVD. Now, the publication, of this study, the protocol is very clear, and the study, the publication, is very clear that the folks getting BV-AVD were required for primary G-CSF prophylaxis because they know there's a lot of hematologic toxicity, and it was optional for the Nivo-AVD arm. So when you look at the rates of people who got primary growth factor prophylaxis, like 100% versus 40%. So the folks getting Nivo-AVD did not get primary pegfilgrastim, and so perhaps not surprisingly, there was more neutropenia. But there was not higher rates of infection, and this has been studied multiple times and verified in several studies. It's part of the guidelines for decades, is that like for ABVD, like this old backbone that then was replaced because of Echelon 2, Echelon 6, whatever that study was, with BV-AVD for these high-risk patients for many centers, was that for ABVD, you didn't need to do the G-CSF prophylaxis. They would become neutropenic, but you didn't see infections because these are typically young, healthy patients. So it is a little bit curious that the publication, the protocol, did not recommend primary G-CSF prophylaxis, but the FDA approval does, and the PI does. Now that's a little curious. Maybe there's some other data to come out or has been published that I'm aware of that explains this. I will say, we have used this regimen, and one of the common side effects of Nivolumab is fever. And so by giving the pegfilgrastim and preventing neutropenia, which would be pretty common, you may prevent the use of unnecessary antibiotics. Because if you have a fever from Nivolumab, and you're neutropenic, you're probably going to, do broad-spectrum antibiotics like it's neutropenic fever, potentially. So maybe that growth factor prophylaxis can prevent some unnecessary antibiotic use. I'm a little unsure about that. It'd be something that would be, I think, warranted in observational studies. But I don't think everyone's going to jump on board to do primary G-CSF prophylaxis with Nivo-AVD. But it is a good regimen. It's a safe regimen. And in just prepping for this podcast, I came across there is a phase 2 study in earlier stage patients here. So we know about using this in stage 3 and 4. That's the Herrera study from NEJM. So we do have, this is the NIV-AHL study, which is a phase 2 study out of Germany, looking at Nivo-AVD in stage 1. And 2 patients, and that has fantastic outcomes and is referenced in our favorite guidelines. So this Nivo-AVD regimen is moving up, becoming a very popular regimen. I think it's a very good regimen, and happy to have this approval, even though I think a lot of folks have already adopted and been using this. A lot of listeners to this pod tune in because they're new to oncology, trying to get up to speed, or they appreciate quick weekly updates to help keep pace with the onslaught of new information in oncology, like this NIV-AHL study that was actually published a couple years ago that I didn't know about. So if this sounds like you, check out the Oncology Insights newsletter, a free weekly email written by fellow Oncofarm Kelly Karlstrom, founder of Kelly C. PharmD and the ELO Collaborative Program. Each week she shares practical pearls, ways to think through oncology concepts without just memorizing guidelines, and insights on staying motivated and growing in your practice. It's written by a pharmacist for a pharmacist, and it's easy to read. You can sign up using the link in the show notes. Okay, so this is going to come out hopefully pretty soon, hopefully Tuesday. Those of you traveling to New Orleans, to NOLA, I've been to New Orleans only in the capacity as attending a conference. My favorite thing to do that I have not been able to do, which is hard to say it's my favorite, would be to go to the World War II Museum in New Orleans. That would be what I would do if for some reason the TSA line is so long I miss my flight on Saturday. Might just go to the World War II Museum. Probably the best part to me about New Orleans, it is a true cultural melting pot from a culinary standpoint. So you have the French influence, which were the original colonizers of Louisiana. You had the native influence, you had the African slave influence, the Caribbean influence. So it's really just a one-of-one unique, truly the definition of unique food scene. So fantastic food that you can't get anywhere else, with jambalaya and crawfish etouffee and gumbo. So it's really great, po' boy. So it's really great just to get, food that you're not going to get anywhere else in the world, let alone in the country. It's a great jazz town as well. Based on there are lots of great jazz. The Preservation Jazz Hall. There's lots of places down Bourbon Street that have varying qualities of jazz. It all sounds good to me. And then, if you didn't know, the Utah Jazz, the NBA team, were originally New Orleans. That's why it's the New Orleans Jazz. There's not great jazz in Utah, as far as I know, but there is in New Orleans, which is why that name is there. Two famous cocktails were invented in New Orleans. The sazerac, which was invented by a pharmacist. In fact, there is a very nice pharmacy museum in the French Quarter in New Orleans that is walkable distance from Conference Hotel, worth checking out. So the sazerac was invented in, the 1800s, 1900s. Historians disagree when it was invented. But that was invented in New Orleans, as was the hurricane, which was invented in New Orleans. So, I favor the sazerac to the hurricane, but to each their own. And then the last thing I'll say, kind of about New Orleans, there's a nice park along the Mississippi River that has some running. There's the steamboat there that toots off every hour or so, and that area was actually a very pivotal scene in the movie The Pelican Brief from the 90s. So if you're a resident and you're going to New Orleans for the first time, that's a little bit of what to focus on. Bourbon Street. If you're a runner, you run in the mornings through Bourbon or through French Quarter. It smells of vomit and urine. It's not very appetizing, but it's a pretty good running town for runners. And I'll point out that again, if you're new, if you're not in your 40s like I was in the 90s, all these John Grisham books were made into movies, and that was The Pelican Brief, starring Denzel Washington and Julia Roberts. It's a pretty good movie, pretty fun movie, but it's set in New Orleans, and so if you're looking for a plain movie, I highly recommend The Pelican Brief on your travel to New Orleans, and also get to the airport early, for crying out loud. Okay, that is what I have for you this week. Those of you who hear this before HOPA, if you see me, come up, say hi. Love to meet listeners of the pod. So thank you so much for listening, and you can follow me on X at PharmDnip and on other social media platforms at OncoPharmPod. And until I talk to you again, remember, doses matter.